Top story is that a BBC investigation has suggested there has been a significant rise in the number of UK primary school children referred to mental health services over the last 3 years.
The Royal College of Psychiatrists describes the figures as deeply worrying. Our special correspondent Ed Thomas has more.
I think it is going to take the death of a child before people start taking it more seriously.
I think the government needs to decide whether they want us to be social workers and mental health workers or educators.
The BBC has been hearing from schools across the country about the mental health of their pupils.
When you have a child in year 4 who is talking about self-harm or talking about suicide, that's shocked a number of staff.
Regularly talking about suicide, wondering what it would feel like, and having those conversations quite regularly.
Freedom of information responses from 46 health trusts across the UK indicate the number of referrals made to child mental health services by primary schools for those aged 11 and under increased by nearly 50% over the last 3 years. Some head teachers say securing support for pupils can be a challenge.
External resources are reducing rapidly because of financial constraints.
CAMHS was the urgency needed. 2 years has taken and we're still waiting for an assessment for a child who's experienced extreme mental health distress.
Primary schools can't solve everything. We need help.
The Department for Education said it was determined to improve mental health services, and by 2024, 345,000 more children and young people will have access to specialist care. Ed Thomas, BBC News.
In a few minutes' time, we're going to be speaking to the head teacher of one primary school about her experience of dealing with children, some of them as young as 4 years old.
It's heartbreaking.
What lessons can we learn and why is it happening as well? We're going to ask all of those questions.
6 minutes.